Here's how it works. Thyroid function starts in your brain. Right? It starts in your brain in an area called the hypothalamus. Your hypothalamus releases a hormone called thyrotropin releasing hormone. Right? That goes to a gland in the brain called the pituitary gland. The pituitary gland then releases thyroid stimulating hormone, or TSH, and that probably looks pretty familiar because that's what you see on your blood work all the time. That's what your doctor runs to see if they've got to up or lessen your synthroid dosage or your hormone or medication dosage for your thyroid. Okay? That TSH then goes to the thyroid gland, and in the thyroid gland it binds with iodine. All right, so thyroid peroxidase binds with iodine. It binds with 4 molecules to make T4. It binds with 3 molecules to make T3. Now here, this is where it gets really important. Okay, the T4 and T3 hormones, all right, then go out to the body. All right. Now, when your thyroid releases those hormones, about 93% of the hormone created is T4, and about 7% of it is T3. This is important because T4 is inactive. It can't get into the cells to perform a function. It's inactive. It doesn't do anything. Okay. T3 is the actually active hormone that gets into the cells to perform the function so your body can function. Okay. And your thyroid gland only releases 7% of active hormone. Okay. So T4 and T3 actually hop on board something called TBG, or thyroid binding globulin. This TBG then takes the hormones to other places in the body to be converted to active hormones. So T4 is taken to the liver, the gut, and other tissues like the muscles, the heart, and the nervous system to be converted to T3. And then from there, it can actually get into the cells or bind to a receptor, get into the cell to perform a function. Okay? So we're going to talk about this pretty in depth because this is pretty important. All right? So if your thyroid gland is working properly, but you have an issue in the liver gut, that may be why your thyroid is not working properly, because you're not able to convert enough inactive hormone T4 to the active hormone T3. Very, very important. Right? So a couple concepts here. We're going to kind of go through this pretty quickly. This just kind of shows you a breakdown on a nice picture here. The hypothalamus releases TRH, the pituitary gland then releases TSH to the thyroid gland. Your thyroid gland, TPO binds to iodine or attached to the iodine. You have 92%, which is T4, which is inactive. 7% is T3, which is the active form. All right, and then from there it goes to other place in the liver, or another place in the body. It goes to the liver, about 60% of it, goes to the gut, about 20%, and then it goes to other tissues. Okay, so those hormones hop on board that taxi cab and go where they need to go to lose an iodine molecule to become an active hormone. All right, some nice illustrations here. The liver, T4 then is converted to T3 because it loses an iodine molecule, and now that T3 is an active hormone to go to the cells. When it goes to the cells, it actually goes to the blood system, it attaches to a thyroid receptor, and gets into the cells to perform a function. All right. So to recap, the key to thyroid function is getting just the right amount of thyroid hormone into the cells, not too much or not too little. Very important. So a quick review of thyroid physiology. All right. The hypothalamus releases TRH to the pituitary gland. Pituitary gland releases THA to the thyroid gland. You get two things. You get T4 and T3. Okay, those are the highest quantity hormones are released. T4 is inactive, T3 is active. They attach or they hop on board TBG. They go to the liver. T4 goes to the liver. 60% of conversion takes place in the liver. 20% takes place in the gut, and 20% takes place in other tissues. Now, with this, you can see if somebody's got a liver issue. Let's say we run blood work and their liver enzymes are very high. All right, maybe they have some cirrhosis going on, or they just got a poor functioning liver. All right, do you think that their hormones are going to be converted properly? No. Okay, so if somebody, we may have to do some detoxification or some type of nutritional support for the liver to make sure that conversion of inactive to active hormone occurs properly. Okay, now what if somebody's got a bad gut? Okay, a lot of thyroid patients have stomach issues, either constipation or irritable bowel syndrome, or chronic diarrhea. If you've got an issue in the gut, that's going to affect how your thyroid functions. Right? And then 20% goes to other tissues. All right? Once those inactive hormones are converted to active hormones, then they attach to a receptor site, they get into the cell to perform the function they're supposed to function.